how's it going?
It's great to see you, Mello. It's been too long.
Yeah, it's way too long. So for our viewers out there, I
Mhm.
want you all to meet like one of my favorite people ever. Uh, this is Anna Stewart Ibarra, and Anna is the executive director of the IAI. And what is that? Like, what is that? Can you tell us a little bit of what you do?
Yeah, be happy to. So, IAI, the Inter-American Institute for Global Change Research. It's a bit of a mouthful, but basically, we work with countries all across the Americas, spanning North America, Central America, the Caribbean, and South America. And we support science on global environmental change, which is a big umbrella that means climate change, biodiversity loss, changes in our atmosphere, oceans, soils, how people cause those changes and impact those changes, and how those changes in our earth systems impact us. So we support science on these earth processes so that our governments across the Americas have better information and tools to make decisions to respond to the threats of these global environmental changes.
Okay,
Let's say the
and
threats and the opportunities.
oh, I like that. I like that framing. And you say inter-American, so I'm just trying to break down what that means. So, what
Mhm.
does inter-American mean? Like, is
It
that like,
means we are support partnerships, cooperation, collaboration across the whole region of the Americas.
oh, okay, so like North America, Central, and South America. Okay,
Mhm.
awesome. And for all, I know the audience doesn't know this, but we met like,
Mhm.
wow, like almost 15 years ago, I would say. Um,
Crazy.
when we were still both graduate students.
Yeah.
And I know you've been doing this work since I first met you, right? Like you
Mhm.
have been totally immersed in global health, public health, and climate change, all merged into one. And so I was just wondering too, like, how did you get excited about this intersection of all
Mhm.
these different fields?
Yeah. Thanks for asking. Like that's dating us. It's going back a ways because even before I met you, so around 2007, I began my PhD research. And at the time, I had had some little bit of research experience as an undergrad, grassland ecology. Grassland ecology means that I was working in Yellowstone National Park and looking at the grasses that were growing there and how the grasses were pulling in carbon into the roots and how weather and the bison that were grazing was affecting this. And so I thought that was fascinating. I always loved to be out in nature, out in the field and doing research, but I really needed the human component. I was like, how can we bring this kind of approach to understanding these complex earth systems, but yet then look at what's happening around the world with issues like hunger and poverty and sustainable development. So when I was thinking about graduate schools, I was fortunate to find the person who became my mentor, um, and they were beginning to work on some different projects related to climate and health in Ecuador. And I'm also Ecuadorian. So actually, this person who became my mentor was a former PhD student of my advisor. So I had my advisor, Charlie, and then Mercy Borbor from Ecuador. And Mercy was just beginning to get some projects going in Ecuador. And she said, what do you think about studying the intersection, sort of the connections between climate, weather factors, mosquito-borne diseases, and social conditions, things like urban poverty, people living in and around cities where these disease outbreaks are starting to explode. And I knew nothing about dengue fever. I knew nothing about infectious diseases, but I somehow something clicked in my brain, the idea of being able to look across climate and social vulnerability and social risk and looking at health as an outcome and something that was really important for people's health, for well-being. And so I said, yes, I want to study that. And I never looked back. I mean, my career path has gone in different directions. I was a researcher and the academics. Now I'm an international civil servant. I work for an intergovernmental organization. But my passion for climate and health has stayed strong all those years, although I wear different hats now and engage in that space in different ways.
Wow. Wow. That is just incredible. Going from doing research, you said in the Yosemite, uh,
Yellowstone.
Yellowstone. Oh, sorry.
Yeah.
Sorry, California. Yeah. from Yellowstone, and all the way to Ecuador. And are you still based in Ecuador right now?
I'm currently in Panama. So I did research in Ecuador from about 2007 until 2019. And then in 2019, I jumped from academia. I left the university. At that point, I was at the State University of New York at Upstate Medical University. And I joined the IAI. So I really made a big switch. I left academia and moved into working, with governments across the region, but supporting science. So more sort of science administration, science management role. And at that point in 2019, I moved to Uruguay and then just 6 months ago moved to Panama, where I am today, because we moved the headquarters of the II from Uruguay to Panama.
Oh wow. Okay. That's that sounds challenging. Like
It was
across.
a busy year. It was a lot, but we
Oh,
made it, and it's wonderful to be here. We love Panama.
wow. I have to visit you there sometime.
It's fantastic. It's such a mix of cultures because you're like right in the middle. So you have Central America, Caribbean, South America, all coming together here, different cultures on the Atlantic and the Pacific side, or the Caribbean side. And also fantastic connectivity. The flights, it's just so easy to get everywhere in the region from Panama.
Oh wow. Wow. So how did you hear about the IAI?
Yeah, so when I was a grad student around the time when I met you, Mello, the IAI, so the IAI has been around since 1992, so 33 years.
Oh
And
wow.
throughout our whole history, we always did a lot of capacity building and training, especially for early career scientists. So as a graduate student, I had the opportunity to participate in I applied and was competitively selected and participated in different regional trainings that were held by the II on things like global environmental change and science policy or transdisciplinary approaches. Transdisciplinary means you're working across different disciplines like social sciences, biological sciences, but you're working also with non-academic partners or experts, people from civil society, from communities, from the public sector, the private sector, to work collectively to develop solutions in science. And so I was really inspired by this approach to addressing, the problems that I saw as huge issues in the region and worldwide, and the II's focus on applied research and also the II's focus on bringing together people from across the region. I think it was really exciting as a graduate student to be able to go to a workshop with 30 or 50 people and meet sort of like-minded people from all across the Americas. That was my first exposure to the work of the II, and then when I was just beginning sort of my career as post PhD, when I was a researcher, then I was a research scientist at the State University of New York. I was fortunate to get a small grant from the II. So it was actually the very first grant that I got when I was officially the lead investigator was from the II. And fun fact, I met my husband on that research project. So I have,
Really?
yeah. And then in 2019, I became the science director of the organization. And now, a year and a half ago, I became the executive director.
Wow. What a journey. That is just incredible to me. And you know, you've been mentioning that, you work across disciplines, across industries, across governments. It sounds like you work with all kinds of people and all kinds of data, which you already mentioned. And actually, I feel like you are like the perfect person to do this because you are just all about you are just genuinely an authentic kind person. And so actually fast forward to like this year, right? You co-publish a book. It's called Transforming Global Health Partnerships. Um, and I feel like you are like the perfect person um, to write this book because I feel like you just care so much and deeply
Mm.
about people, about the environment, about the interconnection and One Health. And I don't know if people know that. And if you want to explain what that is later, like
Mhm.
feel free. And I know in your book, when I read about your book and I read the introduction, what really struck me was you are approaching global health in a way that I haven't seen people approaching it with joy, right?
Mhm.
And also integrating some of the indigenous knowledge systems that
Mhm.
was not necessarily um, recognized as much by the field before. And so, yeah, and the joy part definitely. Oh, what's happening? Hello, can you hear me?
Mhm.
Oh, sorry,
Mhm.
I don't know what happened there, but that really struck with me this idea of joy in doing this work, because when you think of uh, this epidemics and
Mhm.
infections plaguing different countries and different places, uh, it can be depressing,
Mhm.
right? And so,
And not enough resources to do the work also.
yeah, so it's dire situations, and I can see people burning out a lot or getting
Mhm.
depressed,
Mhm.
and so that's what really struck me. So can you tell me more about how you are centering or cultivating joy in this
Mhm.
kind of potentially dire context?
Mhm. Yeah, I'm going to tell a little bit the story of the book because I think that'll help to answer your question. So in 2019, I received a random email from an editor at Springer, which is a major publisher for academic books, just saying, "Hey, can I have a half-hour chat? I'm looking for ideas for new books." We had a half-hour call. I honestly cannot tell you what we spoke about. I don't remember. She said, "What's on the top of your mind?" Hung up the call. Wonderful. A year later, I get an email from her. This is March 2020. You remember what was happening in the world at that time. COVID was just, beginning to turn our whole world upside down, like nothing we had ever seen. And I get an email from her being like, "Remember me? We spoke on the phone a year ago. And I think I want to know if you want to write a book about global health partnerships." And I thought, me? What? Like, that's crazy. I was like, I don't even know where to begin with that. But she explained to me, she said, "What I liked what you talked about was the piece of partnerships and people and relationships. And so that's so important. I don't think there's a book out there about this. It's not like we want a manual, like how to respond to an epidemic, but more about sort of everything that goes on behind the scenes to make an outbreak response possible. Like all that has to happen, all the relationship building, sort of all the things that need to be in place so that when you get to a critical moment like the COVID pandemic, that you are ready and able to respond and really address these issues." And so I thought about it. And again, we're in the pandemic. I was also 3 months pregnant. I just started a new job and moved to another country. So there was a lot going on. But my editor, Allison, who ended up becoming my editor, was so kind. She said, "Don't worry, this is a slow burn. There's no time limit. You can take as long as you want to write this book." And I said, "Okay, like I'm in. There's no time limit." And I ended up calling one of my very dear friends and collaborators, Desiree Labode. Dr. Desiree Labode is a pediatrician and infectious disease specialist at Stanford University. Um, and Desiree and I started meeting like every 2 weeks to just vision the book first. We spent a long time just thinking about our vision of the book. Um, and these spaces of connecting and visioning became really powerful and meaningful for us as people when the world was going through a very dark time. And my feeling was that we were both able to be kind of fearless and authentic. And we were both at a point in our careers where it doesn't matter. Like, I don't need this book to get tenure or to advance in my career. I'm writing this book because I want to say and put down on paper what we really think is most important. And that was really liberating. I don't think that happens very often in academic work. And so Desiree and and then we put together our proposal for the book. I remember we wrote it and we're like, "There's no way they're going to accept this. They're going to throw this out the window." And then we were shocked when they came back and they said, "We love it. Do it. Make the book." And we're like, "Wow, really?" And so we then started thinking about who in our networks we knew who were just inspiring, people who were inspiring regarding partnerships and how you work together in impactful, ethical, meaningful ways at what we call it the research practice interface. So really researchers working with public health professionals or with communities, applied research. And these are people who are dealing with, major global health disease outbreaks, HIV/AIDS, disaster, natural disaster or ha responses when you have things like earthquakes happening. And so we began to and we reached out to our networks to think about who was working around the world. And we were also amazed to see that people actually wanted to participate in the book, right? During the pandemic, when many of our authors were also involved in the frontline response to COVID, we actually had people who weren't able to participate because they were so involved in the COVID response. In the end, we had 90 authors from 26 countries around the world share their perspectives. And what we didn't want a sort of typical dry academic book. We asked people to put their voices and their stories into each of their chapters. So if you look at the book's chapters, which I hope all of your listeners will, because the book is completely free and open access. That was also a dream of ours. We were able to fundraise all the money so that we don't earn $1 from the book, and the book is completely free and open access, so anyone in the world can read it. We asked people at the beginning of the chapter, there's like an author blurb where the authors say that they put their positionality. They say, I'm from here. This is what I believe. This is what I represent. This is my experience. And we asked them to bring their authentic voice and to share their stories in their chapters. And we found that we thought this was really important to change the discourse or the narrative about how we talk about global health and the work that we do, and that it's not this dry sort of academic exercise. No, that we are people with values and beliefs and experiences that are doing this work, and we're doing it together in the best way that we can. And as an editor, then I had the joy and privilege of reading and editing many times all the 26 chapters and really feeling the voices of these people from around the world and the stories, that came up and the threads. And so at the end, Desiree and we had to write, the introduction to the book and think about sort of the key lessons and the messages. And one of the messages that was loud and clear was the joy of human connection. So how that we're all working in difficult and imperfect systems. Like we recognize that there are systemic biases, racism, discrimination, major power imbalances from the global north and global south. And yet we're all sort of committed to continue to work in those systems, to drive change in those systems, to not accept the status quo, but also that the joy of connection is what carries us through and carries us forward. So to be able to um, find that that profound source of energy and motivation to keep going despite difficult circumstances. And I thought that was a really beautiful message that came through. And even the book authors, they told us when they were writing the chapters, for them, it was a very special moment to be able to connect with each other, with many of their dear friends and collaborators who they had worked with for many, many years, and for the first time reflect on what made this partnership possible. Why were we able to work together? What were the unique elements? What worked and what didn't work? And many told us that it was a very touching, kind of a very deep experience to be able to reflect on their collaboration over many years. And when we had a Zoom meeting just a few weeks ago to celebrate the book publication, and one of the authors described the book as a series of love letters. I loved that. I love that image of the book being a series of love letters and a celebration of how people from different cultures and backgrounds and countries can come together, work towards a greater good, and then share those lessons with the world.
Wow. Wow. That is just so lovely. That joy in this synergy, right? Of all this hardworking and like really people who are centering that connection and love for each other, it sounds like, or for others.
Mhm.
That's beautiful. And especially uh in current times where I mean you said right now you're not in the United States.
Mhm.
Um but like you do have partners here in the United States
Mhm.
and like, across the Americas. And so I guess um this is my wrap up too because I know you have to go soon. Um what what words of advice um or encouragement do you have for our public health workers
Mhm.
uh, out there who are our frontline workers, people who are really like the first people to experience the challenge of having to care for others and
Mhm.
not get burned out.
Yeah. I'd say first, thank you. Thank you for the work that you do.
Thank you for the work that
Thank
you do.
you. Yeah. And recognize and reach out. How can we reach out to hold each other, to sustain, to hold each other up in times of difficulty? I think we learned a lot during the pandemic, and yet we forgot so quickly, right? Like about human relationship and the need to connect and to be together and to find ways to connect despite tremendous difficulties. Um, this is we can't do it alone. And yet there is a huge power of people when we come together, when we support each other, love each other, and focus on um, uplifting communities. We have a huge power to do good work and to drive change.
Thank you for that. Thank you. So yeah, I will put the link to the free book. It's free. This is, not typical that you would get a free book that has like just so much knowledge about uh public health and really like the love that goes that you can cultivate in these spaces.
Mhm.
So yeah, thank
And,
you. Oh,
and
sorry.
Melo, maybe one last thing to add. You mentioned about different kinds of knowledge, systems,
Oh, that's
indigenous
right.
knowledge, local knowledge. Um, I think one of the other threads of the book is that we need to have everybody, sort of everyone sitting at the table together as equals. This is also what we call co-creation or co-development, but it's really about creating equitable partnerships where people voices, experiences, and knowledge and wisdom are all seen as equals. And it's a change in the science paradigm where the scientist, the academic scientist is the expert or the knower. And we are pushing back against that to say we need everybody sitting together as equals. We need a science that is more humble, more open, and more focused on listening rather than telling. And this is where there's a critical role also to listen, reach out, and uplift the voices of Indigenous peoples and people from local communities who have firsthand knowledge and experience and millennial knowledge about what's happening in their communities and their territories. And there's a beautiful chapter written by Nicole Redvers and her colleague, who Nicole is an Indigenous physician and planetary health leader, and she writes a chapter about future visions. What do we need? So the whole book is divided into three sections. First, we have foundations, which is about really where we've been and what we know today. The case study section is the middle, and it's where we are. And then future visions is where we want to go. So we're really trying to push the envelope and envision a different, better, healthier, more equitable, and happier future planet. And Nicole's chapter um, and with her co-author is the very first chapter of that section because we thought it was so important to put forth this vision about indigenous perspectives. And it's all about connectivity and interconnectedness and how we need to shift our whole mindset to recognize that we cannot separate ourselves. We are inextricably interconnected with all life on this planet. And the issues that we're facing today as humanity are because we've forgotten that. And as soon as we can shift, if we could really understand what it means that we are completely interconnected, every piece of this web, then we would make very different decisions about our future.
Thank you for that. Maybe that's the first chapter that that we're gonna do a book club about it or something. That could be a cool
Love it.
to do that data
Love it.
with you. Yeah, no, and I really appreciate you coming here. Especially what you just said about uh being equals, right, in knowledge.
Hmm.
And I feel like you are really speaking to what Data Yap is all about.
Hmm.
Or like data and knowledge is for everyone, by everyone, and really like everyone is a producer of knowledge, not just someone with a PhD, right? Not
Hmm.
just someone who's in science. And so yeah, so I really appreciate you, and that's why I invited you to come today because um, I feel like you speak to that mission and that
Hmm.
heart of Data App. So Again,
Thank
thank
you for the
you.
invitation.
Yeah, no, thank you
Great
for,
to see you.
yeah. Well, again, I'm gonna have to hit you up about that book club.
I love
Um,
it.
and I know you have to go help save the Americas now. So, thanks and have a good
Thanks,
day.
Mella.